Well, February is American Heart Month. Heart disease and strokes are two of the most deadly conditions for Americans, and understanding risk factors for heart disease and how to live a heart-healthy lifestyle are a part of practicing self-care for our hearts. Today, we're joined by Dr. Matthew Nelson, a cardiologist and board member with the American Heart Association Idaho Division. Dr. Nelson, thanks for being here today.
Hey, happy Heart Day.
Thank you very much on Valentine's Day, but what better day to talk about heart health, huh? Well, first of all, what is the goal, the mission of the American Heart Association?
So the American Heart Association is the biggest nonprofit group that donates money for heart and brain research. They've raised over $5 billion to teach people, to do research, to do community outreach. Their main push right now is to teach people CPR, bystander CPR. And they've taught over 22 million people how to do CPR.
22, I mean, the big example we see, of course, there were medical experts on the field, but Damar Hamlin, the Buffalo Bills safety who had cardiac arrest on the field, people were there, medical experts were able to give him CPR, save his life. Do you think that that'll have an impact on people learning CPR or?
Oh, I know it has. In fact,
Yeah.
Damar Hamlin has joined with the American Heart Association to help push bystander CPR. What was amazing about that whole episode was that it was really bringing an intensive care unit to the general public. People were able to watch what happens in an ICU. But the two great things that happened there was that, one, people recognized what was going on with him, and two, people were able to start CPR right away, which saved his life.
And so obviously that was a case happening on an athletic field, but what are the common signs or warning signs of a heart attack?
So the most common sign, even between men and women, is chest pain. And I've trained all over the country, and it's interesting that most people describe the chest pain as an elephant sitting on the chest. It's always an elephant. Usually that pain can go up to the jaw or down the left arm. And usually people can have that, it comes on all of a sudden, it lasts, and they come to the ER, or if they're active and they're doing exercise, they can feel that when they're doing activity, and then it goes away when they rest.
Now, is there a difference between the way that may manifest for men and women?
Most of the time it's the same, but women often come to the ER with heart attacks without having chest pain. Sometimes they have shortness of breath. Other times they feel a little nauseated. I've even had people tell me they just don't feel right, and they just kind of wave over their chest.
Interesting. So it definitely vary, and always important to just get checked out, right?
Absolutely.
Don't wait. So what can we do to improve our heart health?
So there's a common saying that says an apple a day can keep the doctor away. I like to say that an avocado a day can keep the cardiologist away.
Okay.
And a lot of it has to do with what we eat. There's really things that we can do on our own. What you put into your mouth is important, how much activity you do, what your weight is, and certainly not smoking. And then there are things that doctors can do for you. We can identify high blood pressure and treat it, and we can also treat high cholesterol.
Yeah. And so, we talked a little bit about the difference between men and women in terms of heart health. What are the details of this year's Idaho's Go Red for Women? So
Go Red for Women is probably the American Heart Association's one of their biggest fundraisers that they do in a year. And Go Red for Women is a luncheon that happens. It will happen on Friday, February 24th at the Boise Center. And there will be about 170 of these all throughout the country. In total, these types of fundraisers have raised about $600 million. There are people who come and share their stories about being saved by the medical community when they had a heart problem. There are silent auctions. There's ways to donate. One can go to the website here and donate online.
Dr. Matthew Nelson, thank you so much for great information on Heart Day, Valentine's Day. Happy Valentine's Day to you, sir.
Thank you.
Thanks for coming in. Do appreciate it.